Is there a specific type of exercise that can reduce your wrist and hand pain instantly? Yes, there is, but it isn't a magic bullet that will help you get back to 100%. It can be, however, a great start for many to start their journey for recovery. Today, we're going to talk about isometric exercises. And as I said, it can be used to get some really quick relief for the pain you might have in your wrist and hand. If you're in your early stages of dealing with wrist pain, or you feel the pain is unbearable at times to the point it prevents you from using your wrist and hand, this type of exercise might help. I'm going to teach you the 4 things that you need to know about isometric exercise so you can use them effectively, but also realize what limitations they might have. Let's start with the science. A well-known researcher in the tendinopathy space, Ebony Rio, published a study in 2015 on 6 volleyball players. It's not a lot, I know, and it showed that performing isometric exercises for 5 sets, 45 seconds contraction at 70% of their maximal effort, with 2 minutes of rest in between, was able to lead to an immediate decrease in pain from 7 out of 10 to 0 out of 10. And the authors suggested that it was likely due to changes in the brain to muscle signaling, cortical changes, along with some local tissue changes. Basically, the brain becomes better at sending signals to the muscles and tendons, along with the release of some chemicals locally that can reduce the pain. And a follow-up was then performed in 2017, which also showed a reduction in pain for individuals with knee tendinopathy, patellar tendinopathy. And what this tells us is that for a certain type of individual, isometric exercise can be helpful in reducing pain. And over the past decade, we actually created a modified protocol for the upper extremity, your wrist and hand, that led to similar results. And it's helped a lot of people in their early stages of recovery find some pain relief, but also help them use their wrists and hands more because they have less overall pain. And this protocol, what I'm calling the 1HP protocol, involves isometric exercises for the tendons at the wrist and hand for 3 sets, 45 seconds between 50 to 70% effort. It shouldn't cause any pain or increase in symptoms, and you rest about 30 seconds between the sets. And this led to a pain reduction that would last for around 45 minutes to even up to an hour, and sometimes even longer for certain cases that we've seen. And what's interesting is that the research has shown and supported something that we've experienced with our patients. It doesn't help everyone. Most interventions don't, since it requires nuance in considering individual circumstances. And this leads me to actually point number 2. Why didn't it help everyone? We experienced some cases where isometric protocol actually made things worse temporarily, and then others where isometrics also didn't do anything at all to reduce pain. There's an actual real reason for this, and it's because pain is complicated. When we actually layer on what we know now with pain science, it actually becomes a lot more clear why there's this distribution of 3 responses. 1, it helps to reduce the pain. In our experience, it helps more than 70% of people. Number 2, it doesn't do anything. That's around 20% of people. And 3, it can make your pain worse, which represents 10% of our cases. What we found was that for the individuals when pain was less mediated by the cognitive, emotional, and the contextual drivers of pain, so think your beliefs, your understanding of pain, your fears, your anxieties around your injury, when it's less associated with that and more around the actual body structures, your tendons, not having the actual capacity to support the amount of activity that you're performing, that's when it can actually be very helpful. And this actually represents most people. But in the other cases, when pain is a bit more complex, you have been dealing with the pain for a while, your nervous system becomes a bit more sensitized, you might have some fears, some harmful beliefs around the injury. This leads to the other 30% of our experience. And to my knowledge, there really isn't any study that has layered on this lens of pain science, and they've mainly focused on the body structures. So current studies have only really focused on the pathophysiology, basically what's going on with the tissues, your nervous system. And they've actually shown those 3 different responses in different regions of the body. Sometimes it helps, sometimes it doesn't, and sometimes it makes it worse. That's what the studies and research says now. If that's the case, how do you make sure it can help you? Or how can you make sure you fall within that 70%? Let me tell you. The third thing we need to know is how isometrics can realistically be used in recovery. And I'll try to make it as simple as possible, but here's our experience. If you are someone that has been dealing with the pain for less than 3 months, That means you haven't had many doctor's visits, which might have confused you as to what is going on, and the pain is only limiting you from when you use it for really extended periods of time. Think at the end of your workday as a programmer, desk worker, or when you game at the end of the day. If that describes you, then you likely fall into the 70% of people that it will help. So try it. It won't hurt you. And that's the great thing about this type of exercise. There's no way that a low-level contraction can lead to any lasting damage or problems for any RSI-related issues. So you can feel safe in trying it for any of these scenarios. But for those that have had more doctor's visits, have been dealing with it for longer, for some cycles of rest that likely led to your muscles and tissues getting weaker, there's just more of a chance that it won't help. And it's mainly influenced by what you believe is going on based on your healthcare visits, your current level of deconditioning, and of course, how you perform the exercise. What we've seen is that those who have been dealing with the problem for 4+ years are extremely confused about what is happening. All of the traditional interventions seem to have failed. Injections, surgery, medication, bracing. The isometrics sometimes don't work because of all of those cognitive emotional aspects that come along with 4+ years of limited progress. And so the practical advice is this. It really doesn't hurt to try isometric exercises. It's something that we tend to utilize earlier in the recovery process for most people we work with. Why? Because it's just a simple way to provide healthy load to muscle and tendons, and the amount of resistance can be controlled since it's mostly applied by your own hand. So regardless of what situation you fall into, try it. If it helps, great. If it doesn't, no worries. You can also try isotonic exercises and just be patient as you build up your tissue's capacity. And if you're in that 10% where it feels worse, then it really requires some reflection as to whether it was actually from the exercise, the activity you performed on the day, or how much you might have been focusing or obsessing about these symptoms. And I know it seems weird, but this can actually increase pain and keep things sensitive. This leads me to the fourth and final thing you need to know, which is how you perform it matters. Makes sense, right? The exercise you select typically determines what tissue you will be targeting. Resisting wrist extension, target the wrist and finger extensors. Resisting radial deviation, targeting radial deviators. Resisting ulnar deviation, ulnar deviators, and so on and so forth. And if you aren't sure what exercise you should be doing and want a clear plan that incorporates isometrics and other isotonic exercises that will help you resolve your wrist pain quickly, check out our troubleshooter below. You'll receive a personalized plan based on your region of pain, specific guidelines for how many and when to do the exercises, and most importantly, you get access directly to us to ensure you're making progress with your plan. So after you've found the right isometric exercise for the region you're feeling your pain in, then it's important to perform the exercise with the 1HP protocol. And here it is again with a bit more depth and guidance. First step, how bad is your pain at rest? 0 to 10. Remember this since you'll check in afterwards. Then you want to perform 3 sets, 45 seconds, 30 seconds of rest in between. Find the amount of resistance where you do not feel an increase in symptoms or pain, or you don't feel like it's causing your forearms to completely fatigue within the 45 seconds. And that's not an easy thing to find, but it takes some trial and error to find the right resistance. And ideally, you do want to get to that 70% effort. But for some of you, it could just be 30%. Others, it might be 50%. And this is because everyone's conditioning is different. So once you're able to narrow down that resistance, then you can follow the guidelines above. After you try it, you can see how you respond after finishing the protocol. How bad is the pain now? Did it go from a 4 to a 0? Nice, then you're in that 70%. Did it only go down 1 point? You're probably in that 20%. And focusing on the endurance will be your main approach. Or did it make the pain worse? Then you're probably pretty deconditioned and have been dealing with it for a while. And to be honest, you might need some more involved support to really find the right level of loading for your wrist and hand, also considering your daily activities. You want to work with a good physical therapist you can meet with more regularly so you can make load modifications appropriately. And remember, isometrics are just one component of a recovery program. It's typically that starting point for the cases we see that are really severe or irritable. And from there, it's important to build up your tissue's capacity with endurance-based exercises. And of course, targeting the right muscle group that's involved. And so today we went over the 4 things you need to know about isometric exercise so you can better leverage it in your own recovery journey. And if you want to learn more about the science of RSI and how you can actually resolve it completely, check out this video right over here.